And in the last part of our town hall, we want to open up more of your questions to Shawnee County Health Officer Dr. Gianfranco Pizzino.
All right, and we're going to get right to our first question tonight. That is from Terry Lammers. Dr. Pizzino, take a listen to this.
Yes, I would like to know what the difference is between being a carrier or asymptomatic. I've been getting mixed messages, and I would like this clarified. Thank you.
All right, so Dr. Pizzino, is there a difference between being asymptomatic and then being a carrier of the coronavirus, or are they kind of one and the same?
They are very similar. Technically, they are not one and the same. Typically, when we say asymptomatic, we mean that somebody has been infected with the virus. They have the virus inside, say, their throat, and they do not have symptoms yet. And so they are before the symptoms, and usually the symptoms then appear at some point, but sometimes they don't, and then the person gets rid of the virus on their own. The term carrier is very similar, but it's more used when you have a chronic condition, when, in this case would be the virus, remains inside you and you never get rid of it, or you don't get rid of it for a long period of time. As far as we know, there are no carriers in the sense of the term for the coronavirus, but there are people, actually most people, even those that become sick at some point, they are asymptomatic before they become sick, so they can transmit the virus before the symptoms appear.
Great, thank you. I think those can be easily confused with one another.
And they're very similar, so
yeah.
you know, they're almost, in the practical terms for the lay person, they're probably one and the same.
Yeah.
And Dr. Pizzino, real quickly, just going off this asymptomatic, one thing I bet a lot of Kansans are wanting to know is, we've seen with the prisons testing several hundreds of prisoners, a lot of them are asymptomatic. Why are we seeing so many asymptomatic people in Kansas?
Oh, it's not just in Kansas. It's not just in Kansas. The reason you're seeing in Kansas is because we are testing the people in the prison, because we knew that there were some cases. But it's something that we have learned over the last few weeks in particular, that this coronavirus does is being present in people who do not show any symptoms. And unfortunately, that presents a problem from the public health point of view, as you can imagine, because it's relatively easy, or at least it's easier, to identify somebody who is coughing and has a fever, and then put that person or those people in isolation, to sequestering those people from everyone else. It's more complicated to do that if the person was already infecting other people around them before they even started to have a cough and a fever. So that's where really testing becomes more important, and there will always be a window right before those symptoms appear where it's going to be hard for public health folks and to identify those people and remove them from the rest of the community so they cannot infect anyone else.
Yeah, the unknowing of spreading it and not knowing they're doing it.
Unknowing and spreading,
yeah.
exactly.
Okay, and our next question comes from Grayson again, and he wants to know, do you expect Kansas to be prepared if this does become a seasonal virus?
You know, preparedness is not an all or nothing thing. It's not that you are not prepared and then something happens and you are prepared. There is obviously a gradient there that takes place, and I think that Kansas, when I compare to some other states, is actually in a pretty good position. If this becomes a seasonal event, it will depend, our level of preparedness will depend primarily on the availability of the vaccine. And the more we can have a vaccine available that can be deployed to everybody, that people can access, so where, you know, access to care does not remain a barrier for many as it is now, the more all those conditions occur, the easier it will be to control the seasonality and essentially turn this into something that will still be a burden from the health and public health point of view, but something more manageable than the situation in which we are now, when you have no vaccine and we have essentially everybody who is susceptible to the effects of this virus because it's a new virus and nobody was exposed before, so nobody has immunity.
And I do have a quick question about the vaccine. We've talked a lot about it. Do you think that when and if there is a vaccine that's created and shown successful, will that anti-vaccination kind of mantra go away? Do you think it'll still be around? What do you think that will look like?
You know, it's really hard for me to guess and anticipate what the people who are opposed to vaccinations are going to think and do, because it's just hard. It's not me. I believe in vaccinations. I've always believed in vaccinations. I've seen the effects of vaccine-preventable diseases in countries where vaccinations were not available. My kids were all vaccinated, so it's a little hard for me to put myself in the minds of people who are totally on the opposite spectrum of my beliefs. I really wouldn't know how to answer the question. I would hope that some level of mix between fear and common sense will prevail at some point, and so people will accept to receive a vaccine as long as the vaccine has been proven to be safe and effective. If that doesn't happen, I just hope that there will be enough people that can get the vaccine so they can also protect those of us who, either by choice or, more important, by medical condition, cannot receive the vaccine. That's really critical. If we don't reach a certain level of people who receive the vaccine, then the protection at the community level will not work.
And you also talked about immunity before we got to this question. We've had several people ask about this one. Mark and Brenda are just a couple of them asking, how can we develop herd immunity as we continue to social distance from one another? First, I want you to talk about what herd immunity even is, and is it possible for this kind of virus?
Sure. Herd immunity, the concept of herd immunity is that the virus is transmitted from one person to the next and to the next to the next. And so obviously the person that receives the virus must be what we call susceptible, so must have no immunity against the virus, so becomes infected and then transmits the virus to other people. With a new virus like this, everybody is susceptible. Everybody can receive the virus and be infected. The more people receive the virus, assuming, and that's a big assumption, assuming that the virus causes a permanent or long-term at least immunity, then the more people receive the virus, the fewer people susceptible there will be to receive the virus later on. Then you reach a point which usually it's around about 60%, sometimes even more, 60% of the population who are immune. From that point on, it is more difficult for the virus to find new hosts, new people who can be infected, because everyone else has already been infected and they are immune now. So that's a concept of herd immunity. Those who were not infected, they are protected essentially like in a herd. They're protected by everyone else around them who now have developed immunity. Can we develop herd immunity for this virus? We think so. We are learning more and more as time progresses, but we think we can, assuming that there is a long-term immunity though, and that's still the big unknown. We know now that people who have been infected do develop antibodies against the virus, but we still don't know for sure if those antibodies are effective then in neutralizing the virus if there is a second infection. How do we develop that herd immunity? Again, assuming that the virus will trigger that kind of immunity when we do social distancing. We can still do that. I think herd immunity is great. It's essentially, again, it's what we are trying to do with the vaccine, right? We try to develop a herd immunity just in a much safer way than a natural infection, because the vaccine is going to be much safer than a natural infection. We just need to do that in a controlled fashion. We can develop herd immunity by exposing millions or hundreds of millions of people in our country to a new virus that everybody is susceptible to, that we sweep through our communities and in a matter of weeks or months infect 60 or more % of our people, overwhelm the healthcare system, and cause many people to die because there is no way for them to be admitted in an ICU or be on a ventilator. Or even if they are, then they may end up dying. If we do that in a controlled way, more slowly, when we can take care of the people who are sick, that's definitely a much preferable way to develop that herd immunity. So there is nothing wrong with herd immunity. We want that. We just don't want that to sweep. We don't want the virus to sweep through our communities and gain herd immunity in that way.
Yeah, because that's, I think, what I believe is where we'll see a lot of the overwhelming of the hospitals. Maybe they can't keep up with all that. And I know we've seen a lot about this in Sweden. I do want to get to our next question real quick. It's from Jeff Morrow, and he actually recorded a video. So let's take a listen.
Since we appear to be using 14 days as a magic number, it seems that any new positive cases in the last 14 days should be considered open, but positive cases more than 14 days old could be considered closed. I feel the overall positive case count is nice to know, but it's not telling us if we're gaining control on the epidemic. Taking into account that we're testing more, the real question seems to be, are we closing the gap?
So Dr. Pizzino, what's your response to Jeff's question?
Well, I think he's asking multiple questions, so I'm not sure I can answer all of them in one answer, but the 14 days, a magic number as he calls it, which is a magic number, I never thought about that term. The magic number 14 days is really for incubation period. It's not for people who have symptoms and are declared officially infected, so to speak, by the coronavirus. But we know if somebody was exposed to a person with the virus, it may take up to 14 days for the person who received the virus to develop symptoms and be recognized as an infected person, and then that becomes a case of coronavirus. So that's 14 days. That has not much to do with how long we consider a case as active. A case is active for as long as it takes until certain conditions are met. And you know, there is a variety of conditions, the number of days from the date of onset of symptoms, and it's you know, whether fever continues or not, and whether there is an improvement of the symptoms, and so on. I think the caller was referring to our dashboard where we show different numbers, and they changes by day, they are updated by day. And I believe we do include the numbers of people who recovered. And that's, again, that's taken from our statewide surveillance database when we have all the cases listed there. And once these people, one by one, once they clear the criteria for being cured, then they are officially classified as inactive cases, cured, and then that's reflected in the dashboard. So there are different pieces of information that we show in the dashboard. I think they're all helpful, but they speak of different aspects of the outbreak.
All right, and we just have about 2 minutes left, so I want to get to our wrap-up question. Where are we on moving to phase 2, especially opening back up salons, barbers, gyms, and other personal care services? I know that these people are ready to get back to work and people are ready to get those services again. So is it looking like that's going to happen in Shawnee County on Monday? And what will determine how to even move on to phase 2?
Well, first let me acknowledge everybody's ready. Believe me, starting with me, I can't wait for the first haircut with my regular barber, and I've been missing that. So there is no doubt about it, and I'm very well aware that many of those are small businesses and they really are struggling. So we will try not to keep, we won't try, we shall not keep them closed for 1 day longer than really needed. Having said that, I wish I could be more firm in terms of dates. There are some criteria that have been established by all the plans that you look at, and there hasn't been any shortage of plans for reopening our communities in the last couple of weeks. But let's just look at the one that came from the White House, the one that came from the governor's office, and the one that came from Shawnee County. And they all have very similar criteria, very interesting. And one of the criteria is you've got to show a downward trend in certain measures that, you know, we won't go into too many details, but that starts with the number of cases in the previous 2 weeks, in the previous 14 days. So obviously for us to start Monday next week, 1 week from today, we will not be able to make a decision until we have at least a sense of where the numbers of this week are leading us. So at this point there is no plan, or definite plan, to move to phase 2 on Monday or not to move to phase 2 on Monday. It's a decision we'll have to make at the end of the week.
And so then real quickly, will it be the number of cases or the number of recoveries and hospitalizations, real quickly? It's mostly the number of cases, okay, and the number of hospitalizations and the number of beds available in the hospitalizations. I know the last two things really usually look pretty good in Shawnee County. So it's primarily the number of cases. Is it going up, or is it flat, or is it going down compared to the 2 weeks before? Remember, it's a 2-week period of observation.
Mm-hmm. And last question real quick, Dr. Pizzino, can you tell me, will there be any chance that we'll be voting normally in November?
That's not a decision for me to make. I would hope that if we do that in a way that's safe enough for all voters who want to go to vote, including myself, and all the workers there. So I think there are ways to make it safe. I trust that the elected official in charge of these decisions will consult with public health and make it safe.
Thank you so much, Dr. Pizzino. I appreciate it. And for all the experts who joined us here tonight, thank you so much.
All right, have a good night and stay safe.